My name's Shane Baker, and I'm a rehab nurse.
My name is Rocio Torrens, and I am a rehab nurse.
My name is Abigail, and I am a rehab nurse.
My name is Naomi Stierbo, and I'm a rehab nurse.
I'm a CRN.
Hi, I'm John Parras, and I'm a rehab nurse.
I do it again. My name is Ronald Dorsey. I'm a rehab nurse.
I am a rehabilitation nurse.
I'm a rehab nurse, and I love what I do.
Rehabilitation nurses work with patients of all ages and their families or caregivers soon after the onset of a disabling injury or chronic illness. They help restore patients' lives so they have more freedom and the most independence possible given the level of disability. Rehabilitation is much more than a philosophy of care. Rehabilitation nurses work and often get certified in this specialty that features abundant job opportunities, professional satisfaction, pathways to career growth, rewarding relationships, and a uniquely valuable position in the healthcare continuum. Rehabilitation nurses have a vibrant and critical place in a patient's journey to recovery. They work with other healthcare team members, including PM&R physicians, OTs, PTs, neuropsychiatrists, speech therapists, and many more specialists to create comprehensive care plans based on patient goals and maximum potential.
Rehab nursing is not something that you hear about much at school, and if you do hear about it, it's in terms of it being less than acute care, right? Which I found to be totally not true at all. When I was randomly placed at a rehab facility for my final clinical rotation, I found that it took a lot of acute care skill to be a rehab nurse, but more than that, there was a focus shifted from the disease management to the health promotion.
I would just like to encourage nurses who might be considering a career path or a career change to really welcome the thought of rehab nursing because it is so delightful. There's so many pathways that you can take, and what you're going to bring home out of it is just as much as what you're going to give to the patient.
Receiving as much as you give. That's a vital part of a rewarding professional life. Rehabilitation nurses experience a meaningful and fulfilling career brimming with opportunities for growth.
There's just such an eclectic pathway that you can take. There's so many opportunities. And in rehabilitation nursing, I have personally seen individuals walk into spaces like case management, coordination, working on the other side in terms of insurances.
Rehabilitation nurses are pivotal in a person's recovery journey. They take great joy and satisfaction in seeing their patients regain well-being and independence. Over weeks, months, or even years, rehabilitation nurses and their patients form strong, rewarding bonds as they work together.
I think one of the most satisfying aspects of being formally in the specialty of rehabilitation is that you're helping people redefine themselves. And it's a real privilege to be a guide in that process.
Rehab nursing brought to me not these snippets of experiences of a patient's medical condition, but the long-term journey of this individual's life.
Rewarding relationships also thrive among the RNs in this specialty. There are over 4,000 members of the Association of Rehabilitation Nurses. ARN is a community devoted to the advancement and promotion of rehabilitation nursing. They provide networking opportunities, rehab certification training materials, and other valuable resources for current and aspiring rehabilitation nurses and care providers. Many RNs find the nursing experience that they've been searching for in the rehab specialty. Rehabilitation nurses are found in many healthcare settings, including inpatient rehab units, long-term care hospitals, skilled nursing facilities, home health agencies, and academia.
We have a lot of patients come from the ICU often. They'll have a trach, sometimes hooked up to a ventilator. They'll have either a PICC line, a central line, IVs. Seeing a patient go from all of those lines to they're leaving and they don't have one line attached to them is amazing. They get to progress in that sense. So I love that about rehab.
If this gratifying career, full of growth opportunities, job satisfaction, rewarding relationships, and meaningful impact on people's lives sounds right for you, then the Association of Rehabilitation Nurses is the way for you to connect, learn, and succeed as a rehabilitation nurse. To learn more, visit ARN online, and you can find a local ARN chapter to meet rehabilitation nurses in your area.